Prostate cancer screening. Should you be screened or not? It's a hot topic of debate after a government advisory panel just recently recommended that doctors stop using the PSA test to screen healthy men for prostate cancer. So what does this mean for men who are concerned about prostate cancer? Well, joining us today is Dr. Scot Ackerman, one of the First Coast's leading oncologists, and he's with us every week to discuss a variety of health topics, and this one is sure stirring up a lot of discussion, isn't it? It's good to see you.
It's good to be here, Nick.
Absolutely.
Thanks.
So there's been a lot of major changes in how we're looking at this, in particular prostate cancer right now, isn't there?
Yes. So recently, a federal panel called the U.S. Preventative Services Task Force came out with new guidelines regarding prostate cancer screening. They are looking at prostate cancer from a little different aspect. These are made up of primary care physicians, and they made a recommendation recommended against annual PSA screening. And they did this recommendation because they looked at some large studies of men that had been screened and men that hadn't been screened, and found out that those that had not been screened, although they were diagnosed with prostate cancer at a later stage, they didn't necessarily die of it so quickly. Mm-hmm. But those that were screened, there was a small number of them that were screened that ultimately had problems with treatment and maybe had some deaths due to adverse effects of the treatment. Oh. And so this federal panel found that the risk of treating can sometimes outweigh the screening benefits, so they recommending against just broad-based annual PSA screening.
So how exactly do you screen for prostate cancer then? It's not the screening that was the problem, it was the treatment that some of these people underwent, right?
Right, exactly.
So the screening is pretty simple, right?
Exactly. That's the criticism of the panel's recommendation, is because it's not the screening that causes people to die, it's the treatment. But let's talk about prostate cancer screening.
Yeah.
In the late 80s, a blood test came out called the PSA, prostate specific antigen. Okay. We like to use initials for everything in medicine.
It's easy.
That way you don't know what we're talking about.
Right.
The PSA, prostate specific antigen. This was developed in the late 80s. It became more used, and then in the 90s it really became more used. And this PSA test looks at the level of the antigen in our blood. So you and me, both men with prostates in our body, have a PSA level in our blood system. But if there's a problem with your prostate, such as cancer, or if there's an infection in the prostate, or just an enlargement of benign growth of the prostate, this blood test, the PSA test, can get elevated. And so we've been able to correlate an elevated PSA with a higher risk of prostate cancer, and have recommended that if you have a high level of PSA, or if the rate of it from year to year goes up dramatically, that we do an evaluation and find out whether or not you have prostate cancer. Mm-hmm. And large national societies made up of cancer physicians, such as the American Cancer Society and the American Urological Association, they recommend annual screening, which includes not just the PSA test, but a digital rectal examination as well. This panel is not cancer focused. It's not just cancer doctors. They're focused on all sorts of preventative services, and their recommendation is against prostate cancer screening. If we diagnose cancer early, and since the American Cancer Society came out with their recommendations regarding prostate cancer screening, we have seen from the early 90s till now a 40% reduction in the death rate due to prostate cancer.
That's huge. I'm sure that completely outweighs this few numbers of complications that were due to maybe the wrong kind of treatment or whatever the case was. But now, what do you think, personally, as a doctor, how do you feel about the new guidelines that have been set?
I'm very concerned that these could be taken too literally. I think that patients need to be advocates for their care. They should ask questions. They should question their doctor. They should become informed about the risks and benefits of screening, because screening can save their life. I have lots of patients who have been screened, been diagnosed with prostate cancer early, have gone through treatment, maybe surgery or radiation, and they're cured, and that screening has saved their lives. When I was a resident, 25 or so years ago in the 80s, we didn't have the PSA test. So men were diagnosed with prostate cancer then in a later stage. It was in their bones. They had a very poor quality of life. They died a miserable death, and it was a very poor quality of life.
So what should we do now? I mean, can we just go in and get the PSA test to check the levels and judge it that way? or do you recommend doing the whole thing, and at what age should we start?
Well, for some men, this PSA screening may not be for them because the results of it they may not want to deal with, and they're concerned about the effects of being diagnosed and being treated for prostate cancer. I recommend men discuss the options with their physician, that they weigh the benefits of screening against the risks of screening. Medicare and insurance companies still cover the cost of the PSA test. As a physician focused on cancer, I recommend that all men over the age of 50 get an annual PSA and a digital rectal examination. I think the two help each other. The two complement each other. Okay. If you're not going to get anything, if you're going to get one thing, the PSA test, but you should get both the PSA and the digital rectal examination. If you're at high risk, meaning if you're either African American or if you have a family history of prostate cancer, you should start this annual screening at age 45. If you're extremely high risk, meaning maybe 2 family members, you should start this screening at age 40. Patients who are advocates for their own health do better. I strongly recommend that patients advocate for their health, talk to their doctors, get a second opinion, whatever. But those people, those patients that question and are advocates for their health are diagnosed earlier, they live longer, and they're cured.
Are there any symptoms if I'm 41, you know what I mean, and I try to stay ahead of the curve. I try to make sure I know everything that's going on with me. I notice any little difference in my body. Some people aren't as aware of their own bodies. Is there any symptom in particular that we should be looking for if we're below 50 and we're not doing the test yet? Or
well,
there any pains or?
Yes, there's 3 symptoms that you should look for as a man that may put you at concern for prostate cancer. The first is increased frequency of urination.
Okay.
That's usually caused by benign enlargement of the prostate. As the prostate grows larger, the bladder holds less urine, and so you urinate more frequently, but that enlargement of the prostate could be from a cancer in the prostate. So see your physician then. Okay. Number 2, bleeding in your urine, blood in the urine. Okay. Could be from either a tumor it could be an infection, a tumor in the bladder, or a prostate cancer growing into the bladder. If you have back pain or other pain, that could be a sign of prostate cancer spread to the bones.
Dr. Ackerman, thank you so much for your insight.
Thank you, Nick.
And we want to also, and also for sponsoring this segment. Dr. Ackerman is with us every Friday, and next week we'll be talking about calcium supplements. Are they good or bad for your health? For questions regarding this topic or any other health questions that you might have, just visit firstcoastoncology.com and confidentially submit your questions to Ask the Doctor.